arthroplasties, and this study is also done at Cork University Hospital, Ireland. And the surgeries were done between 2011 to 2021. We know that DAIR procedures, that is the debridement, antibiotic, and implant retention, is an acceptable treatment option for infected total hip arthroplasty. And it reduces overall morbidity and mortality. And also it is cost-effective and potentially less challenging than two-stage revision. However, the outcome and time to interfere are still debatable in literature. And there is lack of high-quality evidence on efficacy of the DAIR procedure in acute periprostatic joint infection after hip and knee arthroplasty. And objective-wise, the objective of our study was to assess the outcome of DAIR procedure after infection in total hip and total knee arthroplasty. And time to intervention wise, we divided the patient into two groups. One was that who got the infection after 6 weeks of the surgery. Other group was that who have acute hematogenous infection and within 3 weeks of the onset of the symptoms. And we diagnose all the infections by using the MSIS criteria for infection. Regarding methods and material, our study design was a retrospective study, and we included 166 patients with periprostatic joint infection after total hip and total knee replacement. And this study was done at Cork University Hospital, Ireland, and it was done between 2011 to 2021. The inclusion criteria was that all the patients who underwent DAIR procedure for acute periprostatic joint infection within 6 weeks of the surgery and acute hematogenous post-periprostatic joint infection within 3 weeks of the onset of the symptoms. The excellent criteria that all the patients who missing any demographic information or have megaprosthesis or who was not treated with the DAIR procedure for the PJI, they were excluded from this study. And the successful eradication was considered in the patient who were free of the symptoms after cessation of an antibiotic at 1 year follow-up and have normal ES and CRP and did not require any further surgical intervention for the treatment of the infection. And failure was considered in those patients who died and who have recurrence of this infection or who require further surgical intervention for treatment of the infection. Results-wise, 3 surgeons who were fellowship trained and well experienced, they performed the surgeries. And procedure-wise, all the procedures done by doing extensive debridement after taking multiple specimen for microbiology. And washout was done with 9 to 12 liters of normal saline, and liner exchange after thorough debridement was done. And there was no case of loosening was noted. The antibiotic duration average was 8 weeks and range was 6 to 14 weeks. This table is showing the demographic data of the patient who were included in the study. Age-wise, there were 2 groups. One was less than 60, other was more than 60. And 146 patients were more than 60. So most of the patients were more than 60 years of age. Gender-wise, 60 patients were male, female, and 106 patients were female. Preoperative CRP average was 69.49. And ASS status-wise, 26 patients were having grade 1, while 140 patients were having grade 2. And joint-wise, 82 patients included were with total hip arthroplasty infection, while 84 patients included with total knee arthroplasty infection. And type of infection-wise, acute postoperative infection, our patients were 106. That is, 106 patients were with acute postoperative infection within 6 weeks of the surgery, while 60 patients were with acute hematogenous infection within 3 weeks of the onset of the symptoms. And the mean follow-up was 12 months, and range was 11 to 13 months. And this table is showing the outcome of their procedure in our study. We can see from here, as a whole, the DAIR success rate was 76.21%. That is 125 patients got eradication of infection out of 166 patients. And if we talk about the subgroups, the DAIR procedure was successful in 86.5% in acute postoperative infection, and in acute hematogenous infection, it was 58.3%. And in total hip replacement infection, it was 76.5%, while total knee replacement, it was 75.9%. And we can see from here that DAIR procedure is quite significantly more successful in acute postoperative infection. And it is slightly more successful in acute total hip replacement infection. And regarding strength, that from the literature, we know that the outcome of DAIR procedure is quite variable. It varies from 66 to 91% in different studies. And in these studies, the number of patients included were small. That varies from, in one study, it was 21, in other study, it was 47. And there was no consensus on exact timing to diagnose. In some study, it was 4 weeks. In some study, it was just 2 weeks. And no time to intervene. And the criteria to diagnose was also variable in all the studies. And in Dutch arthroplasty register, 80% success rate after DAIR procedure up to 12 weeks was reported. In this case, in this register, the acute hematogenous infection were not included. In contrary to that, in our study, we included large number of patients, 238 patients, and diagnostic criteria was clearly defined. That is, we use MSIS criteria. And time to DAIR was also clearly defined, that up to 6 weeks in postoperative infection. And we also included acute hematogenous infection within 3 weeks of the onset of the symptoms. Limitation-wise, our study was single center study, and it was retrospective design, and 3 surgeons performed the surgeries. So there may be some variation in the technique, and confounding factors such as diabetes, increased BMI, smoking were not recorded. And in conclusion, we found that DAIR procedure is significantly more successful in acute postoperative infection as compared to acute hematogenous infection, that is 86.5% versus 58.3%. And we also found that DAIR procedure is slightly more successful in hips versus knee. And in conclusion, we found that if we suspect PJI, then timely DAIR and appropriate antibiotic is an effective procedure. That's all, and these are my references. If any
Thank you, Doctor.
please welcome.